What's going on, guys? We are going to get all in ACL grad Olivia O'Sullivan joining us here shortly.
Hey,
What's up, Liv? How are you?
I'm great. How are you?
I'm very good. I'm very good. Thank you so much for joining me today.
Of course, happy to.
Um, yeah, so I'll do a short introduction, but nobody will be able to do your story justice as well as you are. So I'm going to ask you to give kind of a full history. But yeah, for those who don't know, this is All in ACL graduate Olivia O'Sullivan. She is one of the OG All in ACLers. Started with us way back in 2021, which is crazy to say out loud. Um, had a super unique recovery, started with us on her fourth ACL surgery, and is now back to running marathons and doing some other incredible things, CrossFit, and just everything else. So, someone that is one of the many reasons that a lot of our clients are on this mission with us, but I feel like nobody is more on this mission with us than Olivia when she just talks about her history. And it's just, she's one of the reasons that we have so many all in ACLers who start with us early on in their recovery or preoperatively or immediately postoperatively on their first injury. Because when we first started this, all the people who started with us right away were people just like Olivia who had gone through this multiple times and learned from their own experience. So I just got to start by saying that you're definitely an inspiration for a lot of people in this community, and I appreciate that. And yeah, tell us a little bit. Yeah, give us kind of your bio and background and history with this name.
Yes. Unfortunately, have a long history with the knee, but I have been an athlete for my whole life. Definitely grew up as a little bit of a tomboy, but soccer was sort of my primary sport. Um, and by the time I was in high school, had sort of specialized in soccer year round, and ended up tearing my ACL for the first time back in 2008. And I had surgery. I did a hamstring graft for my first surgery. And honestly, I had no idea what to expect or what the recovery was going to look like. My doctor told me lots of people get ACL surgeries every year. It's no big deal. You'll be back on the field in no time. And I just remember waking up from that surgery and being thinking to myself, like, oh my God, I was not prepared for what the implications of what that was going to look like. And that was sort of the beginning of a long history of struggling with my knee. I retore the same knee again my senior year of high school, had another surgery, used an allograft, um, had committed to play soccer in college, but obviously, having just had surgery at the end of my senior year, did not obviously play my freshman year in college, and actually ended up having an issue midway through my freshman year of college where my knee locked. I couldn't walk. I went to a doctor, found out that I had a bucket handle meniscus tear, and they couldn't see any of my ACL. And so I had a third surgery under the guise of we're going to fix your meniscus because your knee is unable to get into full extension and you can't walk. But if your ACL is torn, we're also going to fix that. And so signed away that ahead of surgery. Um, Ended up waking up from that surgery. The first thing I asked the nurse was my ACL torn? And she said yes. So we fixed that. Um, and I just remember at that point feeling so demoralized of like, I was like, I haven't even done really anything athletic. Like I've really only been in PT for the last 9 months. So I had surgery 9 months after a previous surgery. Um, And then, yeah, found out again in 2019 that I had another, my ACL, the graft basically failed, had kind of was just like shreds left. At that point was like, I cannot have surgery again. I like, this feels like an insane thing to do. So from 2019 until 2021, I avoided it, was committed to not having surgery, was still doing CrossFit, weightlifting, all these things. And then in 2021, started having a lot of instability. And so decided to have a fourth surgery and was committed to ensuring that I did things differently, that I felt like I had control of the process, that I wasn't just doing the same thing over and over again and hoping that things would be different. And so I ended up finding you, but that's a little bit of my kind of background and story.
Yeah, so first off, thank you for sharing that. And every time I hear it, it's like I know it has a happy ending, but my heart aches for high school Olivia. I feel so bad, but I'm so glad with where you're at. And you were very modest about that. I'm referring back to some of our first with the timeline. Normally I try to know it all, but I'm like with you, I wrote it out to make sure. But Olivia was being super modest in there. She had the opportunity to play Division I soccer, and obviously the knee got in the way of that, as she alluded to. And then when she said CrossFit, being active, doing other things during that period prior to her fourth surgery, she was running ultra marathons. So running ultra marathons without an ACL, and that becomes really important because uh, and it's funny because I always try to walk this line of I never want to be the naysayer. I feel like sometimes people come back from surgeries or injuries and they're like, the doctor told me I'd never be able to do that again, or like my PT told me I'd never do that again. And I never want to be that person, but I always also do want to present honesty and the honest risk rewards of things, right? And I think especially sometimes when people talk about returning to sport and their experience, and like you're a great example of like what athleticism, grit, determination, hard work can get you, right? Like talk a little bit about, some of the amazing things you were able to do without an ACL during that time.
Yeah, during that time with no ACL, I mean, I was playing like pickup soccer with a rec league. I was training CrossFit like 5 days a week, doing like very heavy Olympic weightlifting. I could do pistol squats. I could do snatches. Had no pain really with any of these movements. Was running sometimes upwards of 40, 50 miles a week, was running 50K ultra marathons in the mountains of Colorado. So I feel like, uh, you know, part of my rationale in that period of I really just didn't want to have surgery again. I was like, okay, if I just continue to get strong, strengthen all these muscles around my knees, like maybe I can put this off for a little bit longer. And I think that for that period, like I really didn't have any issues. It then, got to a point where I started having pretty consistent instability, and like things like walking or going downstairs started to become more challenging, which was ultimately what led me to decide to get a fourth surgery. But yeah, for those kind of 2 3 years, I didn't feel inhibited at all by the fact that my ACL was non-existent at that time.
Yeah, and I think, one thing I'll even highlight, because I remember us talking about your hamstring. And so Olivia started with us. She had that experience, was preoperatively, and then chose to have the surgery, but started with us preoperatively, prior to that fourth surgery. And one of the things we did is she kind of talked about, I always felt like my hamstring never got back to, the way I wanted it to be after my hamstring graft, at this point, 10 years ago. And we tested it, and I remember the weights were actually 13 pounds on for a one rep max test on your hamstring. And I say that again, not to be like, oh my God, how weak that is, but it highlights what you actually can do. Like you were, like you said, pistol squats, running ultra marathons, Olympic lifting heavy. And I think there's a lesson in that for some people who are have an injury, even if it's your first time, right? you feel like I'm strong, I'm fit, maybe they're a CrossFit athlete, maybe they're a marathon runner, maybe they're a high level soccer player, and they're like, I'm fit, I'm strong. I had this surgery. Doc said, look, let's get in surgery. Why not do it sooner, right? I feel strong, I feel good, right? And you were hiding some substantial deficits. Talk a little bit about kind of just how surprising that was to you.
I'd like to say it was more surprising than it was, but I think to your point, our bodies are so good at compensating things. Like our body's ultimate job is like you ask it to do something and it's like, all right, we're going to figure out how to do this task that you have put in front of us. And so if if your quads are weak, if your hamstrings are weak, your body is going to figure out some way, whether it's like hiking your hip up or like shifting forward so that you're shifting the muscles that you're using. I think looking back, what maybe a lot of people in this can relate to is like if you are someone who is an athlete or who has historically been strong, or like you have historically been someone who is a gym person, I think that uh, working on your weaknesses is something that feels sometimes uncomfortable. It's like, oh, all of these other things feel great. But I knew like any hamstring isolation, I was like, oh my God, this is so bad. And then you get into this unfortunate state, I think, where when you have a deficit, if you don't focus on it, it just that deficit continues to increase. You never make any progress towards improving it. And then you just kind of neglect it. And I think the thing that I really learned in the process then of working with you is like, one, it's good to be able to expose our weaknesses, but then we also have to be able and open to saying, like, this is going to be a little bit demoralizing in some ways or humiliating that you're like, okay, I have to use 5 pounds or I have to use both my legs to even get this up first, or I really have to go, easy on what this looks like. And I think that that mindset was really important and also important in my recovery then with you was recognizing like, I am very good as someone who has been athletic of like getting the job done, but really that's not always the goal. Like we don't need to rush through things. It's really about building strength and durability in these different types of movements and across these different muscle groups. And like is something that I still hold on to now is like I'm always working on these like little weaknesses and even things still to this day, like I'm still doing things knee maintenance. I like to think of it like in my own strength training now. So um I would like to say it was more of a surprise, but I could tell that I had this deficit and
Yeah.
I just felt like I hadn't really addressed it. And no one had really pushed me though, too. Like I had a lot of physical therapists and doctors be like, yep, good to go, like good to play soccer. Everything looks great.
Yeah. Um, no, that's a great point, and that's something that I think is a lesson for anyone going through this, really, of like, and I try to get out in front of this, and it's helpful to know you and I talked about it, and we talk about it with, anyone who's gone through all an ACL will say we've talked about this, but it's still hard, right? It's like when you go to the gym, you're used to exercising, you're used to the dopamine rush of achieving something, of progressing, of feeling good about yourself for having gone. And in a way, this can, what I say is we're going to test you, find out where you're weak, and then it's going to feel like we're rubbing your face in it. Like we're saying, okay, that thing that you don't feel great about, that, we're going to work on it 3 times a week, right? And over time, it's going to improve, but it's still going to be an area of weakness that we're asking you to continually focus on and remind you of. And that can be very hard. Talk a little bit about, you mentioned obviously someone who's, uh, gone through PT, tons of times, more than obviously just the 4 ACL surgeries. Talk a little bit about your experiences with that and kind of what made this different and yeah, how talk a little bit about that.
Yeah. So looking back, I just picked the PT place that was like closest to wherever I lived. And so when I was living at my parents' house in high school, it was like the local kind of big box PT clinic. And when I was in college, it was kind of like what the sports university recommended that was part of their program. And in those settings, like had wonderful people and really liked my physical therapist and felt like I had a lovely experience as like, oh, I felt this nice warm connection to these people and I actually really enjoyed going. Um, but you get kind of 30 to 45 minutes with a PT. they would be working with other patients. So I might be working with like an aide or someone. And all of these people I felt like had varying degrees of experience in working with ACL patients in particular. And so I felt like in many ways, they were kind of progressing me through a traditional protocol, kind of going through these check boxes. And, at the end of like 12 weeks or whatever that looked like, they're like, great, you're like ready to go and play soccer again. And I just think back, I didn't know at the time. Like, what I often, I think so much of this journey has like turned me into the person that I am. So I can't say like, oh, if all these things hadn't have happened, like how my life would have been different or whatever. But I do think back to, that first surgery and thinking, I just put my full trust in these people that I thought like, oh, they're doing all the things to make sure that I'm prepared to go back and be able to play soccer at this level, club soccer that I was. And now, like, with the knowledge and experience that I have, I think back and like, oh no, like I never did any. I don't think I ever did anything with a weight. Like, the extent of probably what I did was like those like reformers that they kind of have to do some amount of like leg
Those
press.
seem to be everywhere.
Yeah,
Yeah, we've
the
talked to
leg.
so many people. It's like a shuttle leg press that it's
Yes.
basically like a total gym. And yeah, if you want to be playing soccer and yeah, and this is a whole different story, but a lot of people, but it's if you want to get back to soccer at any level, strength training, jumping, running, you need to, sorry, any kind of sport, you need to be strength
Yeah.
training.
Yeah, so a lot of what the version of strength would be like ankle weights and stuff, and like a lot of banded movements and whatnot. And when I think back, I'm like, whoa, okay, after doing no strength training or with like very very light resistance training, they're like, okay, you're ready to go back and play soccer. And I think what's shocking is like I was able to go back and play for the time that I was able to, like almost 2 years. um, but or I guess a year and a half. But now I think about like all that we did just to be able to clear me even to run. And I thought like, wow, I often think, I'm like, if I had had all in ACL or someone like you when I had this first surgery, I really don't think that I would have needed to have all of these subsequent surgeries, which I think is disappointing in the sense that like I'm the biggest advocate that you can get back to like the life that you want, all the things, but like, and your knee can feel great, but like my knee is never going to feel the same as like my non-surgical knee. Like there are just some things about once you have 4 surgeries where you're like, yeah, this just feels a little weird, or like this is kind of, and that doesn't inhibit me in any way. But I think of like, I think I could have had a very different trajectory had I known. But at the time, like I just assumed that the experience that I was getting in PT and the care that I was being given was exactly what I needed. And unfortunately, it took 3 times, 2 times maybe you say like this is bad luck, but I had sort of done the same PT approach. And once you have something happen 3 times, I was like, this is insane. Like I need to do something differently because, you know, clearly something is not going right.
Yeah. I remember our first conversation when you were like, I showed up for prehab PT and they were like, um, just means you need to rehab harder this time. And you're like, I rehabbed really hard, and that's, I think unfortunately, and one thing we've heard, and I can't even remember if this was you or someone else, but people who've been through this before are told like, oh, you've been through ACL rehab before, you know the deal. And it's like, no, 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 no. If it didn't get the outcome you wanted, then the deal is we need a different deal here, and I think that's such a critically important thing for people to understand. And you hit on that you know, the strength training piece of like, and I remember you talked about that in your testimonial, about so many times in PT, we talk about PT exercises, right? And PT exercises, and talk a little bit about how different this journey was with starting strength training early compared to, band walks, ankle weights. We had you in the gym the week you
Yeah.
had surgery, right?
It was a good surprise. Obviously, knew from conversations with you kind of what was in store. But yeah, I think back of even the first few weeks of PT previously when I was just going to in person. It was like, okay, we're gonna get the swelling down. Like we're gonna do some wall slides to start working on range of motion stuff, and maybe they would give you a couple of things to kind of do at home, do some quad sets, some of this work. And I think what I really appreciated about the approach that we took was, hey, we're not going to do anything that the body is not ready for, but like we're going to start getting in the gym. And I remember getting in there the first day on the leg press machine and be like, all right, we got 5 pounds on here. Like we're going to do our
Yeah.
little baby press. But just exposing, the body and muscles to these movements. And obviously so much has changed, I'm sure, from your point of view as well. And even just how more traditional PT is delivered and how people think
Mhm.
about rehabbing and the care. When I first had surgery in high school, it was like no open chain exercises, like no leg extensions. We can't do any of that. Obviously, that was a huge shift. The leg extension machine became my beloved friend by the end of my rehab, but felt like yeah, we were starting to really isolate the quad, isolate the hamstring, start working on, even in small doses, strengthening and progressing as the knee allowed, was a huge difference.
Yeah, no, that's a great point. And I'll even say you talking about how much has changed, and you would hope things would evolve more quickly than they do, but we have conversations with people every day who are being told not to do open chain knee extensions. Like it is still out there, that is still being done. And I think it's shocking, but unfortunately, and I say this all the time, surgeons don't have a lot of guidance on PT, right? They really don't have a lot of training on PT. I've been in big research institutions where the surgical fellows have literally a half of an afternoon that they come down and they shadow PT, and they're getting a fellowship. So med school residency in orthopedics, then a fellowship in knee surgery or shoulder surgery, and they're spending a half a day, in rehab. And it's not a knock on them; it's not their job. But so what they're doing is they're repeating, what they were told by their residency mentor, their fellowship mentor, who was, 30 years older than them, and they're repeating and it's kind of cyclical. And one of the things you talked about is that it's. I try not to be. I never want anyone to say, "Oh, Tommy or all in ACL, they're really aggressive or they're really conservative." We're not. We don't have this dogma we subscribe to, right? It's responding to how you respond and how your joint responds and what your situation is, and then what you need to be successful and what the research says. And for example, one of the things that I think a lot of people say is from weeks 0 to 6, we are ridiculously aggressive compared to what you're going to get in traditional PT. We load people way more because the research is crystal clear that it's helpful, it's fine, and you probably feel better. So
Mm-hmm.
pain wise will go down, your swelling will go down, you feel stronger. But then where people are extra cautious, or where traditional PT and is often, or generalist PTs are often extra cautious, they're cautious in that early post-op phase. But then, as you said, when you've been doing bands and now they say, hey, 12 weeks, you could start jumping, 16 weeks, you could start running, that becomes really aggressive really quickly.
Oh, definitely. Um, I even think for us too, like my experience was probably much different than a lot of other people's because this was my fourth surgery, and you and I had had a lot of discussions ahead of time of like, how do we want to do this? What are we
Mhm.
hoping to be able to accomplish? And my biggest thing was like, I want to get rid of these strength deficits that I have, and I really want to move to a point where I have strength symmetry. And I think for a lot, I didn't run for a year, and for some people that feels like a really long time, but I was continuing to strengthen my other leg, and I was committed to finding that 80% strength symmetry before we started running, which I
Mhm.
think for some people is like, whoa, that's a long time. But it was really because of, you and I had had
Mhm.
discussions around goals and how we wanted to structure things, which I really appreciate, and allowed me to feel like, all right, I am, the other half of this and have agreed of what are we trying to do with this. Um, Versus I think oftentimes my experience with in-person PT historically has been that it was like, this is kind of what we've got for you, and we need to fit you into sort of this framework that we have. which I agree, like no knock to that. Some of my best friends are PTs and they express the same frustrations. It's like
Yeah.
if you're seeing 13 patients a day or 15 patients a day, like it is really hard to be able to deliver that quality of care. Just like we were saying, surgeons' jobs is to be excellent at giving you surgery, and it's not their job necessarily to be experts at how do you deliver post-operative PT. Just like I think it's really hard for a PT to be like, I'm great if your back hurts and if you have ACL surgery and if your ankle's broken. It's like that's also really hard.
Yeah, yeah. No, 100%. And that I always try to say that from I never want to come across as vilifying, and I think you do a great job of this of, you know, I I'm not vilifying any PTs for, I'm not up on ankle research, right? I really am not up on that the same way I would want to be if I was rehabbing, your ankle or my ankle, right? I'm an inch wide and a mile deep, right? And all of us at All in ACL are. And I think it's an unfair expectation, some of what's placed on people. And I always try to say that we're not, anything we say about, I truly believe every PT got involved in this to help people. If you talk to any PT, everyone knows the statistics in terms of ACLers returning to sport at the level they were before. Re-injury rates, at re-tear rates are worse than we want them to be. It's a problem that's known that, everyone would say. So unfortunately, it's like, what do we do about it? And that, I think you're exactly right. Even talk a little bit about, because you worked with an in-person PT on your fourth recovery in conjunction with us,
Yep.
Simone, who's fantastic, and I believe we recommended him, or did you find him on your own? I can't even
It
remember
was
because we
like
recommend Simone so much.
serendipitous. It was a
Yeah,
serendipitous moment where I was like, you're like, I have someone I'd recommend. I'm like, here's who I picked based on all of the bios
yeah,
that I read. You're like, that's the same person I was going to recommend. I was like, that's
yeah.
weird.
Yeah. So you have a fantastic in-person BT. We've collaborated with a number of times, and uh, but talk about how even with that, there are limits in what you can do in the session and what you can accomplish,
Yeah.
and just how that worked, yeah, well together.
Yeah. I think at the beginning, my original intention of like wanting to go to in person PT in conjunction with you was like some amount of accountability where I was like, okay, I'm going to be in here in person and I'm going to commit, to myself that I have this blocked out time during my schedule and build kind of everything else around it, the things that I'm doing day to day. The reason why I ended up picking a PT within a health system, NYU, was like the access to the equipment that they had that I did not have at my gym. So they had a Biodex machine, they had like game ready ice machines, they had all of these different like plyometric things that I didn't have at my gym that I wasn't going to buy. And they had an Ultra G treadmill. So these were things that I wanted to be able to get access to that I knew like I wasn't going to have access to any of those things if I was just going to the gym. Um, but if I think where most of the work happened, it was like in all of the bricks that you stack outside of the 2 times a week that you're going to the in-person PT. um, Even small things like I feel like the heel slides or the mobility work that you're doing kind of day to day, as you're thinking about like regaining full extension, like those are all small things that are happening in the in between times. One of the biggest actually changes in this in-person PT experience and compared to my last was like Simone never touched my knee in terms of like trying to gain flexion. It was like if we were aiming for, hey, we got to be at 90 degrees, he was like, great, do some heel slides, let's see what you got. Like, and he would kind of just stand there and measure it with the little thing versus historically, it's like lay on your stomach, all right, we're going to kind of like crank your knee and see if we can get back full range of motion. But yeah, so much of the work I feel like in progress that you make happens in all of the things outside of the gym. Um, all the little things that add up and being able at a certain point, like I was only going once a week and it was to use the biodex. I was doing testing pretty regularly as we were progressing, but and doing Ultra G treadmill running as we progressed further. But it got to the point where that was sort of like, hey, let's keep using this as a milestone, but really all the work is happening outside of that. And outside of the strength stuff, I think there's so many other components to recovering from this injury. It's like you got to make sure you're eating enough and that you're sleeping and that you're, mentally like taking care of yourself because it's really challenging. And those are all things that, aren't happening outside. But I think if I were only doing, the work in an in-person setting, I probably wouldn't have progressed as quickly or been able to hit the goals that I had. But for me, it created accountability. I also loved seeing Simone in person. I felt really lonely after I had knee surgery. He was like, I'm like, you're one of the people that I spend the most time with right now, besides my, partner. And so that was, yeah, I think really important and allowed me to get access to, tools that I didn't have at my gym.
Yeah, no, that's a great point, and that's one of the things we talk about is the defining line for us in return to run and return to jump and return to play is symmetry, right? But given your history, we know that there's a substantial strength loss, right? And whenever we have access to a biodex, which is the gold standard, right? We're going to take that data, right? Especially when you have a long injury history that we know is going to have affected your strength, right? And I think that's really a key of like, 100% Simone and I worked hand in hand, right? And we're hand in glove. And I think a lot of times people, even he would say, and really, I think a majority of PTs would say that the progress you make is at home. And that's really, the unfortunate reality of this. And I think recognizing the limits of for him to sit there and be able to map out your whole week and managing the loads on your knee and balance all those things is a very difficult thing. And it becomes even more difficult when you're trying to manage multiple patients, when it's a very difficult thing. The sessions are crafted around what are you billing from a therapeutic exercise standpoint, from a therapeutic activity standpoint. And one of the things that it's funny because I think back having worked in a very similar healthcare system as Simone and at Hospital for Special Surgery in New York, when we cut down the visits with COVID, and we basically say, hey, we're going to be one-on-one with someone for a half an hour. It was like a light bulb moment where it was like, if I'm only going to do a half hour worth of stuff, I'm going to spend the whole time. I'm just going to say, we're not going to work out. I'm going to sit there and map out what you can do the rest of your week. And I was like, this is really what I need to be doing with everyone, because this is the way the time is spent. That doesn't really always fly so well in kind of the billing department when you work at a traditional PT setting, but that is really what is needed. And I think that's one of the things we talk about, even when particularly in a complex case like I thought for all you've been through in the surgery, it was great to have that in
Yeah.
person PT, and especially someone I trust, and then to have the biodex data for us was really important. And I think that's just a critical thing to recognize too, that hey, there are great in-person PTs out there, but it's that session-based model is a little incongruent with what all the things we need to do from a load management and load progression standpoint.
Yeah, I will also say too, like to Simone's credit, he definitely also went like above and
But
beyond in terms of like what he allowed
totally.
me to do. I felt like he's like, come early, stay late. Like if you want to use this machine, and I always felt like the people at the desk were like, your appointment's not for another 30 minutes. I'm like, I'm warming up or whatever. Like,
Yeah.
so I agree. Like I think there's a lot of structures where that totally doesn't work. It helped that you guys were so in sync and communicating with one another with everything, but I also think that yeah, yeah, that it's not always conducive for that. But when you
Right.
find that nice balance, and even I think if people just want to have an in-person touch point in addition to what they're doing with you, like you're super collaborative and makes it great where you have your full week planned out. You can be texting and communicating to make sure that you're planning the load, monitoring how things are going, how you're feeling, and you still can have those like in-person touch points if that's important for you.
100%, 100%. And we always like to, yeah, be clear. I think a lot of times people are surprised that, I'd say pretty much all of our PT, all of our patients, all of our clients go to some form of in-person PT, especially those first 3 months post-op, because there are, valid medical reasons to see someone as well, which I think is really helpful. Um, Talk about, what from your perspective surprised you the most about this, about the way All in ACO worked and kind of your experience in going through this in contrast to what you've done previously.
Um, I I think it surprised me how, yeah, it was much more like my normal weightlifting routine than I had originally expected. As we discussed, I think my previous times in PT felt like, oh, these are very different PT exercises. And then I have things that I do at the gym when I'm weightlifting, and these two things don't really cross paths as much. I feel like now there's a lot more overlap. And I felt like there was a lot more intention just around how things were progressing and like what needed to be true in order to kind of progress to jumping or plyometrics or running. Like it felt like there was clear, testing points and criteria of like, okay, now it is time for you to move forward into this. And once your body was exposed to that, it's like, oh, okay, actually, this is too much or this is too little. We need to adjust. I felt like historically it was like, all right, you got, 12 to 16 weeks, and like, we got to check all the boxes in this period of time. This felt like I was really able to have a clear, like a clear understanding of what needed to be true. And there was benchmarks that I felt like were impossible to be like, oh yeah, maybe this is true. Obviously, we used the biodex because we had access to that, which I felt like, oh wow, this is giving me like like very clear metrics regarding my symmetry versus, the idea of like, all right, kick into my hand and like let's see how this feels, and they're like, great, feels good. It's like that to me felt like, now looking back, I'm like, I can't really see how kicking into someone's hand is like letting you know that I have strength symmetry on both sides, and kind of going back to like the weaknesses. It's like, okay, how we're isolating different parts of the body. So, yeah, I think that that was surprising. And then I think that there was oftentimes during this where I felt like frustrated that it didn't always feel like I was progressing as quickly as I thought I was going to based on previous surgeries that was a very accelerated kind of recovery process. Or when I would first be exposed to a movement, I was like, oh, this like feels really prickly or not great. And I felt like having your expertise was really helpful in understanding like, hey, when we're exposing the body to something new or we're introducing these new movements, like things will might not always feel normal, but like this type of pain is actually okay, and like this is pain that we don't want to ignore and we want to be mindful of, and like learning how to better interpret sort of the signals that my body and knee were giving, so that we could continue to progress through my own timeline, not, kind of this version of you've got 12 weeks or 16 weeks to rehab your
Yeah.
ACL. So we got to check a lot of boxes in that time.
Yeah, no, those are great points. And that's, I think especially recognizing that too, of like one of the things you really talk about, and I know you're very good at talking about patient advocacy and advocating for yourself, right? And I think unfortunately you learned to do that the hard way, right?
Yeah.
I'm also a big proponent of that, and I'm also a big proponent of patient honesty. Right. And I remember when you first signed up with us, I was like, before you even signed up, I was like, this is a 2-year recovery. You're looking at a 2-year recovery. And, what do you tell someone if you want them to sign up with your ACL program? You don't tell them this is going to take you 2 years, right? Because that's what nobody wants to hear. But the reality, and that's not to say all in ACL, join us, we'll get you back in 2 years. That is
Yeah.
certainly not what we're doing here. But that is why this is custom. That's why we do this way. And with all your knee had been through and the variations, the variety of things it had been through, and the number of, instability moments you had, it was going to be a different recovery, right? And I think that's a really important point to understand. But for your average ACLer, for someone on their first recovery, right? Um, we need to listen to your joint, right? And we talk a lot about research and criteria. And I think it's really important for you to understand that research criteria, what you're working towards, because it helps with that, mental side. But then also, we also need to, the reason we don't just say, hey, take this booklet, go do it yourself. And when you pass the criteria, go run, is because we need to monitor how you respond, right? And there were times that you could do things, but your knee would respond negatively, right? Whether it was joint soreness or swelling. And I think that's a really important part of managing the loads on your knee and making sure we're progressing you in the ways we want
Yeah.
to.
I also think in an injury like this, like even in the hypothetical world where like you could just take a booklet and do all of these things yourself, I think that it's really hard to keep yourself like honest in these and make sure that you're maintaining like movement integrity, that you're not like progressing things too quickly, that you're not ignoring these symbols. And I think that like, yeah, working with someone like you guys where it's customized, you're able to give that real time feedback and iterate is like so important. And that you like for me created so much accountability as well as being like, hey, slow your roll sometimes, like we might actually just need to like pull off some of this load, or like really what we're trying to isolate is this, or hey, are you noticing that like your hip is dipping in this way, so you're offsetting this out of your quad, now it's all in your glute, like so I think having even just another set of eyes in this process, I think that's what's so great about how you guys deliver the programming and the video feedback is like you do have someone who's kind of like watching you all the time with what you're doing versus, you know, just the time that you're in person. And yeah, it'd be like if you had someone who was coming every time you went to the gym and anytime you did this, which I think was super helpful. It created accountability for me. And like I think there's probably, you know, a group of patients who feel like, hey, I just need the motivation to even be able to go and like do these exercises. And I think there's probably another group of people that's like, I need to make sure that I'm not doing too much, that I'm doing just the right amount, that I'm like, you know, progressing and loading myself appropriately, but I'm not, you know, being overly aggressive in what I think I can do. And that was like really important for me.
Yeah, that's a great point, and I appreciate you bringing that up because I think yeah, there's so many people who feel that of like they're like we get that question. We used to get that question so much. I feel like we really show it now in a lot of our form feedback posts, but we used to get that question a lot of how can you look at my feedback? How can you you know, how can you cue me if you're not there with us? And I always say if you're gonna have someone with you for every single time you work out, you know what? You're probably right. They'll probably film you too, but it's better to have them there with you 24/7. But if not, this allows you to have every single thing you're doing filmed and us to see that and give you feedback. And then, you know, we talked a lot about isolating things early on, but then slowly we do start to integrate because your specific goals, right? We're going to get you barbell squatting. We're going to get you barbell deadlifting. Eventually, for you and CrossFit, we were snatching and hang cleaning and things like that. And you reach a point in this where, like we talked about, again, you're a good athlete. You could have, you know, you were at a point where, hey, maybe you could have hang cleaned, you know, 135 pounds. Maybe you could have deadlifted 200 pounds, but you might not have been treating your surgical side quad as the rate limiting factor at that point. And that I think becomes really important as we start loading you up.
Mm-hmm. I totally agree.
Um, yeah, and I think that was something that especially we see with people who are experienced weightlifters and CrossFitters and good athletes. Um, talk about, you know, if you had to say, you know, looking back, what would you say is the biggest pieces of advice you have for someone who's first time going through this? I just tore my ACL. Uh, tell me the advice you'd give
Um, I think reach out to Tommy. Yeah, that would be definitely one of my top pieces of advice. But I would say, let yourself feel all of the sad, devastating, whatever emotions that you have at the beginning. And then also acknowledge that you will be able to come back on the other side of this and come out stronger than you are currently. The other pieces of advice I would give people is that you should know that this is a very serious injury, that the recovery is going to be long and challenging, and that while it is lots of people do tear their ACLs and have surgery, and it's just another day in the office for the surgeons who are performing the surgery, it is not just another day in the office for your body or the recovery that you're going to have to go through. And so I think acknowledge that it's going to be a long, hard journey that at some points is going to feel like, oh my God, this is so hard. Am I ever going to get to the other side? But you will. And then I think the third piece that I would give twofold, kind of back to what you said, is like definitely advocate for yourself. I would try to consume as much research and information that you can about the road to recovery and returning to sport. I think I would recommend that everyone tries to find a specialist like Tommy to be able to work with, who is very in tune with all of the latest research, understands how to help people return back to sport successfully, and make sure that you are kind of prioritizing people who can help you along in the journey. And I think if you have those things, like you have everything in your toolbox to be able to return to sport successfully. And I think, like, yeah, if you ever have feelings of like, you know, oh, this doesn't feel quite right, or like, I'm not really sure why I'm doing this, or, what are we really measuring in order for me to know that like this is going to happen again? I think ask those questions. And if like people aren't giving you those answers, then I think you need to find something else. And that was ultimately what led me to find you, Tommy, was just like finally me feeling empowered. Like, I'm not going through this again to have, another torn ACL. Every PT that I would talk to, like 4 times, I've never met anyone that has happened to. And I'd be like, I'm so glad that that is me. But I felt like as I started impressing people and asking more difficult questions, I'm like, well, I am doing this again. So like, what are the like quantitative things that I need to see in order to make sure that this isn't going to happen? Or like, why do you think that this has happened? And when people's answers were like, I don't know, I'm like, okay, that's not like, that can't be a good enough answer, which led me then to find you. But that would be the big pieces of advice I would give someone.
Yeah. No, and I so appreciate that. And my first phone call with you, I still remember, like it was an interview, right? You asked me questions, and that's the way it should be. And I always say, like, uh, if someone doesn't want to be questioned, they're not confident in what the answers are, right? And that's not to say that we say, hey, we know everything, right? There's things we don't know, right? And there are things that will never be known, right? However, we have to have an understanding. I think a lot of times, and you touched on this earlier, about there's a little bit of a, I'll use the word like paternalistic attitude sometimes in medicine, where and it's not necessarily wrong, where like, hey, you're not necessarily going to go to a patient as a doctor and say, which drug would you
Prefer.
prefer to take, right? It's like, that's not really their call. It's you tell them. So that makes sense. But when a something like this occurs, when you have to do, the way you're going to come out successful on the other side of an ACL surgery is you
It's your
putting
work.
in a shit ton of work by yourself. And, whether someone has an in-person clinic, whether they're a doctor, pretty much everyone will tell you pretty much anyone will tell you it's what you do at home that's going to get you back on the field, back to running. So when that's the case, you're a very motivated person. But even for very motivated people, you have to have somewhat of an understanding of what you're working towards and why and how. And I think that's something that we say, like you asking these questions, you don't have to be on your fourth injury to ask those questions, right? You should know coming out of surgery, what do I need to do to run, right? What do I need to do to jump? What do I need to do to return to sport? What are the things I could be really aggressive to do to get me there? And what are the things I need to be wary of? What are the pitfalls I want to avoid? And by laying that out, it kind of lifts that mental burden of uncertainty that I think a lot of people have in this recovery of like, I'm trusting the process. I'm hoping it gets better.
Yeah. Yeah. And having those, yeah, more clear milestones. And I almost feel like exit and entry criteria of like, once you can do X, which we are going to be able to measure, like, then you can do Y.
Yeah.
I think this idea of like, we're just going to kind of do these things and like, you'll keep moving forward,
Yeah.
um, creates a lot of like ambiguity, which I think can be confusing. But yeah, I would empower everyone to like ask questions. And I really loved my last surgeon for his ability to fix my knee. But it is true. Like, I think it can be difficult to ask some of these questions because some people aren't like used to being asked questions, or people will frame things in ways where your assumption is, oh, I really need to do those. Or my doctor maybe many times was like, why aren't you running yet? He probably asked me every time I would go back to the doctor. And I was like, don't worry, I have a plan. Like, I'm
Yeah.
not at 80% strength symmetry. Once I get that, we will be progressing forward. But like, we have a we have a plan.
Yeah.
And he would often say, he'd be like, well, yeah, you're not at 80%, but like, you probably could start running if you want to. And I was like, yeah, thanks. I was like, I hear what you're saying. Like, I'm just going to stick to like, we've got a good thing going on. I feel good about how we're progressing. But like,
Yeah.
you don't always feel comfortable saying that when you're like, this guy's a doctor and like, he should know these things. And so I think finding people also who you feel like are on the same team as you and who are also going to advocate for you helps you feel like you can advocate for yourself as well. Of like, ask questions, it's totally fine, and sometimes you got to push back on things, and that's also okay, because ultimately you're going to be the person, to your point, doing the work, but also the person who is stuck with the outcome of this. And I think like if I'd probably asked more questions, 14-year-old Olivia did not know to ask these types of questions. And, my parents are like, oh man, like we probably should have asked more questions also. But now I feel like if I could give one piece of advice to people, it's like, make sure you feel like, yeah, you can advocate for yourself. You can ask questions, even if it's your first injury, or if it's like me, your fourth, that like you're going to be the person who's on the hook ultimately of whether this is successful or not. And some of that is the work in the gym, but some of that is making sure that you're getting the right PT, that you're picking a specialist to work with, that you're making sure that you're set up from success from the start.
Yeah. No, that's a great point. And listen, you are well researched, and a lot of people do. And I'd encourage you to do your own research and look into it, but it's hard, right? It's like I can do all the research on, building a house that I want, but if I go
Right.
build one, I'm going to hire a contractor, right? And that, I think viewing it from, the two simple questions to ask are, how many of these do you do a year?
Yeah.
Right? Whether it's a surgeon or a PT, how many, ACLs do you work with a year? And number two, just what was your criteria for this, right? And you'll get a sense if someone's criteria is like, yeah, I've been watching you work out. You can run. I've been, I see the way you move. You're good. That's not an answer, right? And you know in your bones that's not an answer. Even if you want it to be the answer. Because we've talked about and I'll highlight again. I think Olivia started in prehab. We talked about this being a 2-year recovery, and we wanted to overcome a lot of over a decade worth of compensations of levels of instability of some muscle asymmetries on both sides. But that's not what we say. Oh, to do this the right way, it needs to take 2 years, right? Because of people like Olivia who've gone through this multiple times and share their story, we now have a lot of people who start with us on their first injury in prehab. And that's a totally different recovery. That's the opportunities that we want for more and more people to learn from, not just, hey, I went through this, the first time. So that for me is, I just want to say that too about prehab and what an important opportunity that is. And that's the way the system is set up. People rarely have the opportunity for prehab. However, there are studies showing that 2 years post-op, your outcome will be substantially better if you did about 3 months of prehab. And that 3 months of prehab includes strength training, strength testing, really isolating those muscles and building them up. And I think that's an important piece to touch on. We talked a lot about what you went through when you gone through. Talk about where you're at now, because I think it's going to blow some people's minds, when yeah, you're just talking about what you're doing now.
Yeah, I feel like I'm back to my regular life, which is great. I just played pickleball the other day, no problems with that. I do wear my sports brace, though, but yeah, I'm back to running marathons, running ultras, weightlifting. I just ran a marathon, I guess it was like 2 weeks ago. Um, which was great. And yeah, I feel like I have my life back, which is amazing. And yeah, ran a marathon, no pain, no issues, no problems. I was a little sore the next day, but not any knee soreness. And honestly, even with this marathon and an ultra that I had run last February, I remember the first time I ran like a full mile outside, and I thought to myself, like, I'm never going to get back to running. And this was after like a whole year, of rehab and feeling really strong, but like, my knee was really not used to the sensation, was feeling all
Yeah.
types of prickly, and also, my aerobic capacity was not feeling great. And I just, even this marathon when I was running, I was like, this feels now, and I have a much different relationship, I feel like, with a lot of these things. Like, I have this really kind, nice voice in my head now. I used to be like a little bit more hard on myself in some of these things of like, oh, if this is painful, like, you should be able to push harder, like, you should be able. But I think through this experience of like this last surgery, I feel like I have so much joy that I get to be able to do all of these things again. And I feel like now when something is hard, I'm like, you worked so hard to be able to do these hard things again. And it is like so wonderful. And I feel so much joy that I get to be able to do these things because I certainly don't take it for granted, and or that was it, guaranteed that I was going to be able to do this. And yeah, it was a lot of hard work to get there, but I feel like now, yeah, I feel like anything that I want to do, I am able to do that, and like my knee is not a limiting factor in that at all.
Yeah. No, that's incredible because and I think, and say that again because you said marathon because it happened more recently, but ultra marathon February of last year, right?
Yes, February of
Which
last year.
which would be how many years post-op?
I guess that I am
Because
like
surgery was
3,
2022,
20,
so February of last year,
so it's like just about 2 years, two and
just
a half
about two
years. Yeah,
years,
yeah,
which isn't good. And that's what I want to say too, like in highlighting that, hey, on the one hand, I think most ACLers would be like, oh my God, like you didn't run until a year post-op. Like I could never. That's, I could never do that. And like you said, your surgeon was like, what's going on in your rehab, right? Like it sounds like it's a disaster, right? But then you're running an ultra marathon at, just
two,
over 2 years
yeah,
post-op. Um,
yeah. And I think, yeah, I think like what is true is once you're getting to like this kind of back portion of your recovery and you're more, you know, you're getting back into running and you're doing more return to sports stuff, like it feels both that progress is like a little bit slower in the sense of the beginning, it's like, okay, I can move my knee like 5 degrees more. And like all of these little things feel like it's so quickly adding up. But building strength is hard, and like building power and agility and speed, like are not things that just like poof happen in a week's time. And so you have to stack more bricks. But obviously, as you already have this big base that you have built. And so even probably 6 months into me beginning to run again, I started working again with my running coach. And I remember just being like, just an FYI, like I'm really unfit. like, my aerobic capacity is not good. And he even said to me, he's like, you've got that in there. Like it'll come back quicker than you think. Like your body knows how to do this, and like it'll come back quicker than you think. And even now, like this marathon that I just ran was at like 7:49 pace 2 weeks
it's
ago, and
insane.
I remember thinking like, oh, the first mile I ran was like a 14-minute mile, and I was like, this was so hard. And
Mhm.
so some of it is just like the stacking of bricks and continuing to progress things forward. And I think that, you know, there are certainly things like I'm probably never going to play competitive soccer again because like I just don't feel like that's worth it for me. Like I don't, there are some things where I'm like, I'm choosing. I think I could play soccer if I wanted to. I played pickleball, cutting, all this stuff. There are
Mhm.
some things where I'm like, you know what? I'm not going to do that. But I think that everyone is capable of like returning back to whatever things that they want, and like as long as you are willing to put in that kind of hard work, and sometimes yes have to take a step back, like you can get back to whatever it is you want. And like I always say, like if I can get back to these things after 4 knee surgeries with no pain, like we can all get back, no matter how complicated our injuries are, to like the things that we want.
Yeah. No, that's like I said, and I'm not just gassing you up here. That's an inspiration. It is like we have so many ACLers who were like, wow, if Olivia can do that, like I'll stop complaining. If Olivia can do that, I'll like, okay, you're right, I will. And I've used you as an example so many times of like, yeah, I remember that first run, right? It was like it wasn't this, magic moment where, the skies open up and rain when you were like just ascended into running ultras again. But it was like, you knew you had the strength, we knew the criteria was there, and that it does snowball, and you built that brick foundation. And I think that's the key thing too, that I always want to say is like time is a multiplier, right? It is not inherently good. And I think so many ACLers fall into this trap of feeling like if I, more time equals more better. And that's, if you run before you're ready, you can keep running all you want. It is unfortunately not going to get better. But so I don't want to, when you hear me say that, and the first time you ran, it was you were able to complete it. It didn't feel, totally normal, but it was you didn't have a ton of pain. You felt good doing it, and but us saying, hey, more time running. It's not that that's always the case, but it's you knew the criteria you met, and it was okay. We know you have the strength, and now you can run. And then I think the thing I want to highlight too is just because, you were running ultra marathons without an ACL, right? But it's how you feel now that, I'm most proud of that. Hey, 2 weeks after a marathon and even, earlier, your knee is fine, right? Your body was sore more than your knee was sore. And that's really what we wanted to achieve with taking kind of the road less traveled.
Yeah. And besides just the knee, like the thing I would like my final thing would be I also built like way more strength, you know. I feel like all of this work really helped me to isolate my quads and the hamstrings that had historically been weak. And so I think yeah, not only did I get back to all of these things and feel really good, but I feel like now I'm way stronger, you know, than I was kind of going into this process. Um, and yeah, everyone else is capable of achieving that too.
Yeah. No, I've said it before and I'll say it again. You're absolutely an inspiration for people who are going through this and wondering, can I ever get back to that level? Can I, play soccer again with the same, veracity? Can I ski again? Can I, run marathons? And I think you're an inspiration of being able to do that and being able to do it successfully and being able to do it continuously. And it's the strength you built that's going to allow you to do this at, not just 30, but at
Yeah.
40 and 50 and, as you age. And I'm so grateful to you. I say this all the time when I first used to do these calls with all in ACL. And if you ever have a call with me, you'll hear me say the same thing. I'll say there's two groups of all in ACLers. There's people who start with us later on in this recovery, 3, 4, 5, 6, 7, 8, 9, 10 months post-op. Have people start a year, 3, 5 years, and they're typically underloaded early in PT, and then they're rapidly overloaded. Then we have people who start with us right away. Those people who start with us right away are usually people who've been through this injury once before, trusted the process, and then suffered re-injury. Now I've had to add to that as we've grown. We have more and more people who start with us learning from someone else's experience rather than their own. And that's really the mission, because the earlier we can start, the better we can get a plan together, and the smoother we can make this recovery. So I'm so grateful to you for being a part of that, and for taking a leap of faith on this before we had all the stories like we do now, and for helping this to grow what it is, and for joining me today. Thank you.
Yeah. Thank you so much for having me. And you're so welcome. I'm glad that you're able to help so many more people. And yeah, hopefully anyone listening to this reaches out to Tommy on their first injury to make sure that your first is your last. So thanks so much, Tommy. I appreciate it.
So appreciate it. Talk to you soon.
All
Congrats
right.
on the
Thank
marathon
you.
and the engagement.
Thank you. Bye.
Bye.